all for joining Assemblymember Limon, Congressmember Carvajal, and myself for this, our 7th teleconference town hall. This important call is being translated into Spanish on a separate line. Our translators will be simultaneously relaying the messages of all our speakers, working hard to interpret exhaustively, accurately, and completely. Those listening to the translation only hear the single voice of the interpreter, so I'm going to ask our speakers to state their names each time they speak so that listeners are able to identify who is in fact speaking. And you may also notice that we are going to pause a little bit more than usual to allow the interpreter to catch up, and there may be times that we get a request for a clarification from the interpreter, so we will be ready for that if it happens. And with that, we will begin. Well, this week we've had some momentous developments as Governor Newsom has announced that based on the state's progress in meeting metrics tied to indicators, the state could begin to move into stage 2 of modifying the stay-at-home order this past Friday. The next step is part of the governor's 4-stage framework to allow Californians to gradually reopen while we continue to carefully follow guidelines to ensure our safety and our well-being. We have a great panel of speakers joining us today from Ventura and Santa Barbara counties who will update us on how we are meeting these important benchmarks to align with the state's reopening framework. We have with us Mona Misato, who is the CEO of Santa Barbara County, Van Do Reynoso, who is the Santa Barbara County Public Health Director, Bruce Stensley, who is the Economic Development Collaborative President and CEO, who will talk to us about both what's happening in Ventura and Santa Barbara counties, along with Mike Powers, the Ventura County CEO, and Rigoberto Vargas, who is the Ventura County Public Health Director. So we will have lots of expertise, and I look forward to the questions. We've got a number of them that we'll be asking shortly. Now, our counties are taking every precaution to ensure we move forward safely. Every decision made is backed by science and data to support those decisions. We recognize the impact of economic hardship. As we move forward, we want to work with our businesses to make sure they are making the correct modifications to ensure a healthy and successful environment. We want to get our economy thriving once again and put paychecks and money back in people's pockets. But the risk of COVID-19 infection is still real for all Californians and continues to be fatal in many instances. The virus is not gone. It hasn't been contained. We don't have a cure for it yet, and we don't have treatment. So we must be very mindful of the risks that it continues to impose and to threaten to our public health. We have reached this stage thanks to the efforts in abiding by our stay well at home orders, and every member of the community gets a great appreciation and thank you. But we know we are eager to return to normal, but we cannot ignore the guidelines that are still in place. And we know these are not ordinary times. We have a new normal that is still evolving, and we are still attempting to understand. So, as we carefully ease restrictions, we have to do so cautiously and carefully. We have to limit our risk of exposure by continuing to practice physical distancing and protect ourselves and the health of those around us. With that, as I mentioned, we have a great set of speakers, and if there's any follow-up, please feel free to contact my office. My website has a lot of information about the resources available, so feel free to go to SD, as in Senate District 19, senate.ca.gov, and click on the coronavirus link. We will also keep the audio live stream on my website along with notes from the call if you're unable to join us for the entire hour. And again, thank you for joining us this evening. We hope that the information provided will be helpful, will be beneficial to you as we continue to respond to this public health crisis. And with that, Assemblymember Limon, please give us your opening remarks.
Thank you so much, Senator Jackson. Thank you, everyone, for joining us this evening. We hope that the next hour or so we can answer as many of your questions. We know that there are a lot of questions out there. Certainly they're coming our way, and we know that while we have made progress, there's still some anxiety about what the future holds, and the ways that we can both perhaps move into different phases of the reopening, but also stay healthy, which is very important. What I want to reiterate to everybody on the call tonight is that you should know that your, federal, state, county, city, local representatives are all working together. I know at times it feels that we can pinpoint to one particular person or one particular entity for making decisions, but we have scientists, doctors, local government professionals, so many people that are in the room making these tough decisions. And tough they are. I think we all recognize that we would love to be reopened. We would love to be in a space where we weren't living the way we are living, but certainly the health of our community has been at the forefront. So please know that while all of us are eager to be in a different space, we recognize that these are very tough decisions, and these decisions are being done in the best interest of the community. Today we will answer a lot of your questions, and I hope that you find it useful. You can always follow up with any one of our offices. Like I said, we're all working together and in communication, and we look forward to continuing to be a resource for you. So thank you very much, Senator Jackson.
All righty. Well, thank you, Assemblymember Limon. And now we will have a few opening remarks from Congressmember Salud Carvajal. Salud. Are you with us? Have you muted your phone? No? Salud? All right. Well, we do know that Congressman Carvajal is going to be heading back to Washington tomorrow. They're going to be voting on another major effort to reinfuse our economy, and I suspect he is on mute or on an important call, but we'll get back to it. So without further ado, let's go ahead to our featured speakers and ask them to say a few words. We'll start with our Santa Barbara County CEO, Mona Miyasato. Madam Miyasato, the floor is yours.
Thank you so much, Senator Jackson. I appreciate it. Good evening. I'm Mona Miyasato, County Executive Officer for Santa Barbara County. So thanks to everyone listening for working so hard and keeping our collective county safe. We know this is really difficult for everyone, and everyone is making a sacrifice. So we do appreciate it, and I say that heartfelt on behalf of the Board of Supervisors and the entire county. On a hopeful note, we know this won't last forever, although I know it feels like it. There is light at the end of the tunnel, and we're all on the same team in trying to make that day occur as soon as possible and as soon as we can do it safely. Before I begin, I just want to reiterate a few things, and that's the general twofold strategy of what everyone is doing at the local agency level. That's continuing to protect our public's health by boxing in the virus, and our Public Health Director, Mondo Reynoso, will talk a little bit more about that, and also taking actions to prepare for reopening and restarting our economies safely as possible. And Senator Jackson mentioned about the stages of reopening, and I just want to emphasize that all the counties are following the governor's orders, and most urban and suburban counties are in stage 2 for low-risk businesses. And how we move into the next stage, which is called stage 2 for high-risk businesses, is dependent upon meeting certain criteria. And our public health director will talk about that in a few minutes. And if we do meet that criteria, it would mean destination retail, dine-in restaurants would be open. And I know the next stage, stage 3, is when gyms, personal care, hair salons, movie theaters, those things would be open. And those aren't until phase 3. And the governor intends, he said, to move everyone together if possible. But I want to talk about our reopening plan and what we're doing in Santa Barbara County. We're looking at reopening plans, if we can do it safely, for the whole community, for our physical as well as emotional and economic health. And later this week, we're releasing our reopening plan called RISE, which is an acronym for Reopening in a Safe Environment. So let me talk about 3 things that you'll see in this reopening guide: why we're doing it, what's in it, and how people can provide input. Why we're doing this is the RISE guide would supplement the governor's resilience roadmap. It would fill in gaps and create a science-based approach that takes into account the special attributes of Santa Barbara County, like the fact that we're a tourist destination, and we have students come from all over the world and the state to our colleges and universities. and that we have an urban, suburban, and rural diversity within the county. And if and when local discretion is permitted by the state, the guide will inform local decision making. We want to make sure we're consistent with the governor's roadmap, but we also want to make sure we're advocating for what's needed in our county to open safely. So what else is in it? Our health officer, Dr. Henning Answord, commissioned an expert panel to develop the guide to look at safety in reopening the economy. So the guide provides parameters based on epidemiology, hospital information, public health metrics like testing, for when the public health officer may need to tighten or loosen restrictions and at what points. It really recognizes that restrictions aren't on-off switches, but dials that need to be turned and titrated carefully. As we know, the governor is determining many of the criteria, so our RISE guide provides supplemental metrics to that. It also provides the best practices by industry to help businesses prepare for reopening. These are intended to be instructive. They are compiled by from a series of roundtables of 27 different groups, over 300 participants, because it was really important for us to hear directly from our community by different sectors and areas on what the pain points will be, as well as their really innovative ideas, and getting that back to the expert panel. Since we've started this, the state's come out with their own sector guidance, but where there isn't sector guidance yet by the state or where guidance allows for discretion, these locally generated guidelines will be helpful. And finally, how can people give input? We did an expedited process to provide feedback quickly to the expert panel so that we were poised and ready for reopening as soon as it's safe. But even after the guidelines are done, there'll still be a way to give input. It's a living document, and we will have a survey on our website for anyone to fill out and provide further feedback. As we know, this process will continue to evolve as we move through further stages of the governor's roadmap. Thank you.
Thank you. So let's go to Dr. Van Do Reynoso to share with us what her strategy and what her observations are.
Thank you, Senator. I'm Van Do Reynoso, and I'd like to talk about our efforts. So the mission of public health is really to protect the health of the community by preventing disease. And how we are preventing disease is really by looking at the COVID-19 infections and boxing it in. So we begin boxing it in by testing widely. I'd like to share with you that Santa Barbara County started our community-wide testing, and that is available at 3 locations, in Santa Maria, in Lompoc, and in Santa Barbara. Anyone can be tested at these 3 community testing sites. They are available 7 days a week at from 7 a.m. to 7 p.m. by appointments. So that's testing widely. In 1 week of testing, we were able to provide 1,518 tests, and some results are coming back. And so far, we're getting less than 1% positivity rate, so that is good. But for those who have a positive test, I'd like to talk a little bit about contact tracing. It goes hand in hand with testing widely. So contact tracing is a critical tool that public health uses to stopping the spread of COVID-19 by helping to diagnose people earlier and reducing the chance of spread. So once a person tests positive for COVID-19, a nurse investigator conducts an initial investigation and collects all the essential clinical information. Then that case is transferred to a tracer who connects with the case and interviews them and get a sense of all the close contacts who may have had exposure. The contacts then are monitored by staff. This means that temperatures, symptom checks at regular intervals are done. And to protect privacy, whenever possible, contacts are only informed that they may have been exposed and not told the identity of the person who may have exposed them. The contacts are provided with information, what symptoms to look for, and instructed to self-isolate themselves until 14 days after their last exposure to the confirmed case. And if during that monitoring period, if the contact exhibits symptoms, we test and the cycle repeats itself. And so that is how we are able to box it in, keep our community healthy, and getting us all to return to fully being reopened. And that ends my update.
Thank you very much. Let's go to Ventura County now, and we'll ask Mike Powers, who is the Ventura County CEO, to share what's going on in our Ventura County community.
Thank you so much, Senator Jackson, Assemblymember Limon, and Congressman Carbajal. And nice to hear you, Mona, and nice to meet you, Dr. De Reynoso. So just very similar here in Ventura County efforts to what's happening with our colleagues and partners in Santa Barbara. Our numbers here are very positive. We're keeping our number of positive patients, COVID patients in the hospital fairly steady. And that's one of the key metrics that we're watching, and that's a credit to the community's compliance with the stay well at home orders and our businesses complying. And so that has enabled us to move forward as Santa Barbara and other counties are on the governor's road to reopening. And so we're making a lot of progress, and big progress this week, in fact, for the state. Just a couple of things about here in Ventura. Looking at those the key metrics, of course, moving down the road. You got to have good hospital surge capacity, and we're good there. PPE being adequate, but our vulnerable population piece too, and that's so important. We focused on our public health leadership, our long-term care facilities, and that's been such an area of vulnerability, frankly, where there's been many outbreaks, and so they've instituted a plan where any positive patients there could be taken care of in our local hospitals, and that's really helped out. And then they're doing focused testing on any of those areas if a couple of the staff or the patients test positive. And I think that's really helped, again, identify and contain the spread of the virus. At the same time, we've been very active in housing our medically fragile homeless, and we've got over 340 that are housed now, and we think that's been helpful to contain the virus as well. And we're in the process of expanding our testing and tracing capacity. All of that said, of course, now that's enabled us to move forward on the road to recovery. So we were able to open the retail curbside, of course, but also manufacturing and supply. And we just want to let people know that it's bigger than it might seem. And obviously, it's very important to have our retailers reopened, but manufacturing as well. We had one manufacturing company here in Oxnard that does beauty products and so forth. It has 2,000 employees. It's the largest employer in Oxnard. Now they're fully reopened and doing so safely. But we also want to be sensitive to the fact that our local retailers, particularly our mom and pop stores, are now competing with the big box stores and online retailers. So we're hoping that at some point soon they can reopen as well. And we know they'll do so safely, because that's what's been so wonderful through this is that the business community has come in with a spirit of compliance. They get this. They want to do it right, and they want to protect their workforce and their customers, and they have great ideas about how to do it, and that's really helped us move forward. We also developed a registration site so that businesses could register and meet all the governor's requirements and attest to that, and all they have to do is register, and they can reopen. They don't have to get inspected before they do. But we also have like a verification ambassador program, county and city workforce that go in a consultative way and just check in on the business, see how they're doing with their physical distancing plans, and just share best practices as well. And then, of course, Dr. Levin modified his local stay well VC order to align more with the governor's order, and so now we can move quickly right away, which we did the other day when the governor moved into regular stage 2, offices, outdoor malls, pet grooming, which we got a lot of comments and interest in pet grooming, and landscape and childcare, of course. So those folks are reopening as we speak. Florists, of course, we're very excited to be reopened for Mother's Day. One of our local florists had 11 trucks out there the day before. But so a lot of good things happening in that space. We have now, we're tracking the number of businesses that have reopened under this. It's up to 968. Is the last number that we have, and so we're watching this. We're watching the reopening happen, and really doing everything we can to encourage that and work with our partners like EDC, Bruce Tinsley, our chambers, and our cities just hearing that feedback and where are the pain points. Of course, we've already touched on to go to advanced stage 2, where we could open seated dining as well as indoor malls and so forth. That has very high criteria, and like Santa Barbara, we meet most of it, but maybe not all of it, and so we're engaging with the state just to let them know that we feel like we do have the capacity from a public health standpoint to move certainly forward with the restaurant piece, and so we are engaging in those discussions as we speak. So lots more to come, and the one thing we just want people to know is it's not a choice between the health or the business. These measures that we're taking to improve our health, and protect against, contain the spread of the virus, protect our community's health, but they also allow us to move forward in reopening our business. And it's our new normal, right? We're going to come into this in ways that it's just going to be different going forward, and that continuous commitment to physical distancing is going to allow us to reopen and stay open. And with that, I'll turn it over to Rigo Vargas, our Public Health Director.
Very good. Thank you. And Dr. Vargas, anxious to hear your thoughts on the opening and how it's impacting the fight against the virus.
Yeah, thank you, Senator Jackson. And I like the sound of Dr. Vargas, but I don't have a doctorate, but thank you.
All right. Well, it doesn't hurt. We'll
yes, right? Yeah.
Yeah. All right.
All right, but thank you. So, just a little bit on our efforts here in Ventura County, a little bit of update on our numbers. Our colleagues in Santa Barbara certainly covered it very well in terms of the test tracing efforts. Similarly, in Ventura County, we're going on full force with being ready to expand our tracing efforts. And so we've trained 40 individuals already and expect to train another 30 by early next week. And so that allows us to have teams, 7 teams of with 10 people each as tracers that will then be able to follow up with at least 10 individuals. And so we feel very comfortable that we have the necessary infrastructure to follow any individual that has come in contact with a positive person in Ventura County. And we've done this training, I think, similar to our colleagues in Santa Barbara in-house, while the state rolls out formally their training module that I believe was developed by a couple of the universities. And so other counties were actually waiting for that opportunity to retrain them or that enhanced training that is coming from the state. But we didn't wait for that to roll out before we started ours. We're very pleased with the support that we get also in our county with our Board of Supervisors, our CEO's office, so that we were able to expand our communicable disease team and our data surveillance team to be able to further track and report on this disease. And so we're getting additional staff on board to enhance our communicable disease, emergency medical services, and our epidemiology teams. So I think that's about it in terms of overall efforts. Just a quick update on our numbers that we're officially releasing today. We'll be reporting 25 new additional cases. That brings our count to 725 positive individuals in Ventura County. On a good trend in terms of testing capacity, it seems like every day we're making progress with additional test sites. I believe we have over 9 test sites in Ventura County for the community to come in and get tested. And with that, we're reporting 454 folks that were tested yesterday, and so we're reporting that number today. That number keeps on going higher and higher each week. Until recently, we were reporting 200 to 300 on average, and now it's a couple hundred more. In fact, our public health laboratory continues to be busy today. They ran a full shift of tests. They're still running at that, but they expect to run 200 tests. And so the need and the interest for testing individuals is there, and Ventura County is ready to and has the capacity to test individuals. So I'll end my comments here. Thank you.
Thanks so much. And let's have Bruce Stensley, who is working and the President and CEO of the Economic Development Collaborative in both counties, share with us what's going on from his perspective in each of the counties, very briefly, and then we'll get We got Congressman Carvajal back online. There were some technical difficulties. He forgot to hit the unmute switch. I'm sure that's what it was, but we'll give him a chance to say a few words, and then we'll get to our questions. But first, I'd like to have Mr. Stensley share with us his perspective with respect to both counties.
Thank you, Senator and hosts, and thanks, of course, to the listeners and for the questions to come. And our role at the EDC, Economic Development Collaborative, is we are the Small Business Development Center for both Ventura and Santa Barbara counties, as designated by the U.S. Small Business Administration. And in doing that, we have fantastic partners with Women's Economic Ventures and the SCORE chapters working together. And while our role, going to this whole concept here, is around business support and focus on business, I just want to, of course, assure that it's done wholly in the context of understanding our needs and values for public health and safety. Now, so fortuitously, our experience in the last several years, for example, with the Thomas incident and other disasters, has prepared us somewhat for this circumstance. And what I mean by that is about the collaboration and assuring that we have a culture of mutual aid, of public-private leveraging of resources, and making sure that we're being as efficient and strong together as we possibly can. But of course, never quite prepared for this scale. Speaking of scale, and I'll just look at Ventura County for a little bit of data and then use that as a leverage or as a stepping to get into a couple of very quick points and be done. And when I say scale, as of about 10 days ago in Ventura County, we've had more than 80,000 unemployment insurance claims filed by our local residents. 80,000, that's some 25% of our total labor force. And while there's a wide spectrum of individuals there, this is definitely and predominantly our most vulnerable populations. Low-income workers, little in reserve, few employer benefits, and concentrated in a couple of key industry sectors in both counties: the hospitality, the food and hotels, the arts and entertainment, other services such as mentioned salons and exercise studios, which aren't yet ready. Coming up in stage 3 will be ready to open. And finally in retail, which in both counties is a significant number. And if you take those sectors alone, it's between a third and a fourth of our total workforce populations or of jobs in the two counties. So where are we at now? The point of the scale on that is to talk about the urgency of trying to find not just how we're getting businesses back open, but workers back to work. And we're making a huge transition from what are essential businesses that have been open ideally since the start of this crisis, but now looking at how do we identify business with manageable risk and establish the criteria, and how do we support them, public and private resources, in opening and finding how we go from essential to low-risk businesses. A couple of really important points that both counties are working very hard on is making sure that we've got the resources to meet the governor's requirement or the statewide requirements for opening. Businesses need work site specific plans. They need to do risk assessments. And while those can sound daunting, in both cases we're creating the resources, the tools, the counseling, the networking that helps businesses figure out how they do that, because we want to open our businesses not just keeping our consumers safe, but of course keeping our workforce safe. And we want to do this expertly now, so we build a foundation of how to do this so we can soon start opening up restaurants and opening up a wider range of businesses. So it's a very critical point we're in now, and public-private resources collaborating to get open. In closing, I would just say a couple of other things. Where we've been heretofore is about relieving some of the crisis, that is helping businesses access loan funds, helping workers access unemployment insurance. And now we're talking about reopening. But our next big step as we get businesses reopening is about reimagining what a new economy looks like, what a new work environment looks like. Instead of having just requiring people to work from home, how do we figure out how we do that expertly and maximize our productivity? How do we help businesses come up with models of e-commerce and social media? How do we manage customer service relationships in a new environment? How do we manage supply chains? The collection of organizations with EDC, our Small Business Center, with Women's Economic Ventures, with SCORE, with partnerships with the cities and the counties, we have the resources. Reach out to us, and we'll do everything that we can to facilitate a business opening safely and getting this economy back on its feet. That's good for me. Thank you.
Great. Thank you so much, Bruce, as always. And now, Congressman Carbajal, just a couple minutes, and then we're going to get right to the questions because there are some really interesting ones. The floor is yours.
Great. Thank you. Well, first of all, sorry about that. I had some technical difficulties getting online early on, but let me just start by thanking you and Assemblywoman Limon for helping organize tonight. And I want to thank the general public who is joining us tonight and with their questions. I also want to thank our county speakers that just presented and that will be helping us answer the questions tonight. I understand everyone has experienced a tremendous amount of anxiety, stress, and frustration during sheltering at home and the closing of our businesses and loss of many jobs. Having been in isolation for now 56 days, we are all looking forward to getting back to a semblance of normalcy. As has been stated previously, reopening is not going to be a flip of a switch. Opening will be gradual and grounded in sound science and medical guidance to ensure a safe reopening. I know there are questions about testing, tracing, and treatment that will be answered tonight. We also have questions about the Lompoc prison outbreak and its impact on being able to reopen. I want the public to know that I am working on this issue with our local, state, and federal officials. I look forward to tonight's conversation. Back to you, Senator Jackson.
Great. Thank you so much, Congressman. And yes, thank you for your working with us on the Lompoc prison issue, which I know has been a source of anxiety as well for many people, the high numbers and the fact that it is counted in whether or not Santa Barbara's meeting its metrics in order to expand its opening. So let me start, and what we'll do is I'll ask the first question, go to Assemblymember Limon. I'd like to perhaps direct the question. Last week we had everybody on board, but I'd like to just simply direct the questions to specific individuals, and if anyone has additional comments, to please feel free to jump in, but we'd like to get to as many as we can. So I want to start with a question on testing. Here's a question that was brought to us. What are the public health guidelines for keeping seniors living safe in senior homes and facilities, and how can we ensure our seniors are being well cared for? I've been visiting my mom, says this person, every day for the last 3 years, making sure she's hydrated and properly taken care of. I want to know about testing in nursing homes, employees and patients alike. Also, some of the employees work at a different facility down the street or in town, possibly taking the virus from one facility to another. I'm not really getting any information from the facilities, and I can't visit my mom. So why don't we start with, I know that both counties have a number of senior homes. Let's have Mr. Vargas answer this question for us.
Thank you, Senator. So yeah, in Ventura County, we've been, I think our colleagues in Santa Barbara and throughout the state, very proactive in taking care of our most vulnerable populations, namely our seniors, those that have comorbidities and other priority populations. On this one in particular, our health officer has zeroed in on to try to protect in several ways. One is that a few weeks ago, it's probably closer to a month, we worked very closely with all of our area hospitals to come up with a program by where as long as there was one individual that became positive in a long-term care facility, they were transferred into one of the hospitals and one of the wings to be cared for and removed from the location so that the exposure to staff and fellow residents would be minimized. And so that program is going well. Happy to report that I think we've only had like about 7 or 8 individuals go through that program that needed transferring. Believe all but one has been returned back to the long-term care facility, but that was an important measure that we took to protect the health of individuals. So we've been also offering testing on site, both supplying the long-term care facilities with equipment, supplies, other personal protective equipment, and also testing whenever there has been one or more case. We test all staff and all residents of such facilities. So all in all, we're very proactive in protecting our vulnerable population in the long-term care facilities.
And briefly, Dr. Dova Reynoso, similarly in Santa Barbara, what has been your approach, if it's been any different?
So like our colleagues in Ventura County, we are working hand in hand with our nursing homes, making sure that they follow our local guidance. And we visit them to ensure that infection control procedures are followed. I know that an outbreak in a nursing home has severe consequences, severe outcomes. So that is one of our prioritized groups. Our nursing homes and other senior living facilities don't allow visitors per our guidance, but we want to encourage that people maintain contact with their loved ones through telephone and video chat so that contact with friends and loved ones are maintained, because I think that interaction and support is important and critical. There are several ways to protect skilled nursing and other facility residents. We know that staff are wearing masks, are using gloves and gowns when necessary, and a strategy for regular testing of skilled nursing facility employees is being created by our health department. These are really good practices to help ensure that all the employees who do, some of them, work in different facilities and are also more active in the community are not carrying the virus or spreading it to the facilities. So I was just going to offer that if there's any specific questions or concerns about a nursing home in Santa Barbara County, that would love to invite community members to call our county health call center, and our staff will assist you. And that number
Thank you very much.
That number is 833-688-5551. Thank you.
Great. We'll have that on our website as well tomorrow. Assemblymember Limon, thank you so much for that question. Assemblymember Limon, the floor is yours.
Thank you, Senator Jackson. This is Assemblymember Limon. The next question is, how do we navigate the space between what is permissible and what is safe, especially for vulnerable members of our population? Should we really wait to be social for an entire year or wait until there's a vaccine? And either county can answer this.
I could take a stab at that. That's a really good question. We get that all the time, especially from regarding older members of our community. And it really depends on the individual's health status, how much outside the home activities within the parameters can be entertained. And I would want to encourage the individual to have that conversation with their provider so that their best health can be maintained.
Okay. Anyone else want to add in? If not, we'll go to Congressmember Carvajal.
Thank you very much. This question is as follows. Can someone address the plan for all levels of child care to reopen, from daycare, preschool, and elementary through high school? Many parents can't return to work until this is addressed. Many of us can't accept jobs and can't get off of unemployment insurance until this is addressed.
This is Bruce Stensley. I'll jump to the front end of this question, and maybe others can answer the rest of it. In terms of child care, happily, the governor's order yesterday, and so effective today, child care as a business model is open for business. There are a couple of concerns with that in terms of how effective or how large we can do this. Number one, a lot of child care centers are located on schools, and schools are not yet fully open or open in just about at all. So some of the facilities, some of the infrastructure is still curtailed. Secondly, while we're putting some workers back to business, for childcare to work, those are businesses too, and they need to be running at near full capacity to really work as a business. And so it's sort of a one-step, two-step process. As we start getting workers back to work and they need childcare and they're putting their kids back into childcare, they can start opening up. But right now there really isn't that much labor back in the labor force, so it's been difficult or it will be difficult for child care centers to open. Happily, there are CARES Act resources in the Governor's Office and State Department of Education, and other agencies at the state level are starting to move resources to support child care's wider expansion. The real problem here, though, is child care will be fully open when all the schools are open, and that's not immediately on the horizon as part of stage 2. I would defer to one of the county or either of the county administrators who might be following that more closely on that large scale.
Hi, this is Mona Miyasato from Santa Barbara County, and he's right that child care in schools, rather, are envisioned to be open as part of phase 2, but they haven't been opened yet. We just had a meeting with our community group on schools, including our superintendent, and I know they're struggling with this because some schools will be able to open because they probably have the space for social distancing and some protocols, and others won't. So I know that the schools are struggling with this, and they're developing plans as we speak.
So could I follow up on that then and ask, this is great that we're opening them. Children have problems sometimes following the protocols of good hygiene. They're kids. Is there any concern from our health people as to what the potential consequences are? We've got a bunch of little kids running around. Hopefully they will not suffer severe cases of this, but the possibility that they will be infected and asymptomatic and then bring it home, is that a concern to either of the counties?
Yes, that is a concern. We know that, especially among primary kindergarten through at least K-5, that children are not fastidious in personal hygiene. That is a worry of ours. But on the flip side, I think that with proper messaging and reinforcement, that children are more diligent when they see the value of certain practices in order for them to be healthy, in order for them to protect their parents, their family, grandma and grandpa. So we are working with our school system and rethinking how do we get that messaging and how do we do positive reinforcement, and then how do we structure the physical environment to really encourage that healthy practice.
Okay.
Yeah, and Ventura, kind of like to add real quick that remind our listening audience that there's a state guidance on this, and so I believe yesterday with the governor's announcement around child care and this topic, there's guidelines that would address some of the issues around screening and proper hygiene and so on. And so the state superintendent is also coming up with some guidelines, and so I think it's an evolving situation. But the state also has, I think previously the governor announced that there's resources for families to find child care resources and options. So we urge all members listening to look up for those sites.
Great. Well, thank you. And that sort of leads into the next question, which is about the summer. As we are planning for summer, do you have any guidance on the ability to operate an in-person summer program? And what would it look like? And I'd like to throw in also the issue of pools. We had a whole bunch of questions on private club pools, on whether or not there'll be a reopening of pools in some hotels and motels. So summer's coming. How are we planning for that, and what can we anticipate?
We are seeing summer in-person summer camps as in the same bucket as childcare. And so broadly, the state's guidance is to treat the childcare setting. There are recommendations to keeping the summer program then with services to the same group of kids with social distancing and disinfection and personal hygiene practices in place. With regards to pools, we did issue some guidance around pools. So for those who are living in Santa Barbara County, we want to encourage you to visit our website to look at Health Officer Order 2020-8.1. We have placed guidance around pools in that Health Officer Order.
How about Ventura County? Summer camp? No summer camp?
Yeah, Ventura County, we're aligning our efforts fully with the state, and we don't see pools and summer camps in even the accelerator or expanded stage 2. So unless things change, but if and when it does, we'll be ready to provide guidance to our local facilities around it. But we just don't see it in stage 2.
All righty. Okay, Assemblymember Limon.
Thank you, Senator Jackson. The next question is, given the projections for California, we strongly believe that reopening guidelines should be tightened. Further, there must be enforcement. For example, yesterday in Avon, some employees and customers were not wearing masks despite front door instructions. How will you enforce these and other essential practices? Is there compelling evidence to support workers and patrons wearing face masks, and if so, why not mandate it as a condition of staying open?
Hi, this is Mike Powers, Assembly Member. I'll jump in on that one from Ventura County's perspective. So from the outset, we've worked with our code enforcement environmental health team along with the city, partnering with our city code enforcement folks to create a verification program, and they've been very active in going out and visiting the grocery stores and the big box stores to make sure that they were implementing physical distancing guidelines and only letting a certain number of customers in at a time, areas being roped off, and got really good to compliance. There were some challenges at the beginning, to be sure. There was some gathering at the very beginning, but once the team started going out there, then the stores really were great partners in that. And this same, we call it sort of our ambassador verification teams now. They're going out very active at all of these stores as they're reopening and doing it in a consultative way to make sure that they have a physical distancing policy posted, that there's an employee on site who's responsible for ensuring compliance, and that there's a compliance hotline that we staff here at the county, and that also has a phone tree to our city partners as well. So that was something, it's finding that right balance, right? Dr. Levin wanted us to be able to, public health officer, move forward as quickly as we could, but also as safely as we could. And so having this verification program really gives that comfort level to him, and it allows us to share best practices. And overall, our experience with the businesses is that they really are, they do get it, they want to comply, and they want to do things safely.
And I would second that. We follow the same approach. Our value is really to provide that guidance. We have found that there has been 1 to 2 businesses that we need to reach out and reinforce the guidelines or the mandates, what's spelled out in the health officer orders. But for the most part, we lean towards heavy on the education in order to change social norms. And we have found for the most part that our community want to be in compliance and want to do the right thing. So, and we do have teams of our environmental health services staff on surveillance, and we have not found widely lack of compliance with our health officer orders. So for the most part, our community are very diligent in doing the right thing.
So, Bruce, let me just jump in. This seems like a good place to have you sort of present it from the business side. What do you suggest and advise to the businesses who are trying to reopen and create these guidelines and best practices?
I would agree with what everyone has said. Our overwhelming experience is that business has been incredibly compliant and conscientious because they've got two views they've got to manage simultaneously, and that is the care and safety of their employees as well as the care and safety of their customers coming into the businesses. We really encourage, though, that every business that is open, including and especially for this discussion, including and especially the essential businesses that have been open since the beginning of this crisis, that they go back now to the governor's site or to the county sites and through those access these guidelines that have been designed for each business model and industry sector, take a look at those checklists and double down on making sure they've got their systems and compliance in place. What happened when we let essential businesses stay open early in this process, we did have all sorts of standards, and the counties did a dynamite job through their public health offices, et cetera, of helping them understand the conditions for them being open. But we didn't have the advantage when they first opened of studying this, of developing very rigorous criteria, of compliance manuals, and now that we have them, what we need to do is make sure those businesses are aware of that and that they take a close look at them. It is going to be human nature that employees are going to get a little bit lax about standards because, as mentioned by several of us, people are just getting a little bit weary and worn out. But we can't let our guard down, and I don't think it's people are looking to let their guard down. I think they're just a little weary, and we just need to make sure that we're reminding them and pointing them to these guidelines and checklists, which look onerous at first, but if you just think through them rationally, they're well designed, they're manageable, they're practicable, and they will help us keep safe and allow us to keep opening up the economy, which is our real goal here.
Bruce, do you have that link? Can you recite it again? Because I'm sure this will be helpful for a lot of the small business folks on the line.
I can cite a couple of different links. We can go to our own website, edcollaborative.com, and from our homepage there's in huge red ink a COVID-19 link that will take you both to these local and to the state sites. I would encourage, I'll leave it to the county executives to identify their sites. And the state, I believe it's I don't have it off the top of my head. I'll pull
That's
it
right.
up and send it to you.
Why don't we do this? I'll make sure it's on my website, and I'm sure that my colleagues will do the same so that people can know exactly where they should be going to get that information. And we'll thank you for that. We'll now go to Congressman Carbajal. Do you want to ask a question about our friends up in Lompoc?
Well, let me ask the question I was going to ask. This is, I cut my own hair, you should know, but I have heard a lot of people asking about salons and barbershops. So I wanted to ask, when will hair salons and barbershops be allowed to offer services again is the question that was posed here.
This is Bruce. I can hop in. Others may have a better answer. Those appear to be stage 3 business models as sort of personal services as a general category. And to understand that, it's because the execution of those services is in very close proximity and hand-to-hand and body-to-body contact. And there are systems that are being put in place and care guides, and we will get there in stage 3. But it's not part of stage 2, and we're still midway moving through stage 2. So yeah, I need a haircut badly, and I could really use a gym, but they're a little ways off.
And a pool, and some of us would like to have our nails done. I got you. All right.
So Senator Jackson.
Yes.
Senator Jackson, if you'll allow me, thank you for that answer. But back to Lompoc, I don't want to gloss over that. Knowing what we know of the Lompoc COVID-19 numbers, can you share with the public what that has done for the Santa Barbara County COVID-19 numbers, the ability to open up sooner rather than later, and what is the answer to opening up Santa Barbara County considering the Lompoc numbers?
So Lompoc did start their mass testing last week. And because of the mass testing in one of their facilities, we have had a significant spike in the number of cases in our county. So it's a heavy impact on the total number of new cases in our county. And so what that means to us is that the state's variance metrics, which is a set of metrics that a county can go through and attest to the state for the ability to speed through the initial opening of stage 2. So moving faster than what the state says we can is through an attestation phase. And so what that attestation criteria, first and foremost, says that we cannot have more than 45 new cases in our county in a 14-day period. With the positive cases in Lompoc, that is wholeheartedly not attainable. So as such, the Public Health Department, with support from our board and our CEO's office, emailed the state for reconsideration, asking them if we can parse out the inmate numbers. The board also sent a letter to Dr. Ghali and Governor Newsom, as well as Dr. Angel, head of CDPH, for the same consideration. And so we are uncertain what the state's decision will be, but until that gets parsed out, we will be delayed in our ability to attest for a faster, speedier of reopening of stage 2.
And I can tell you that I know Assemblymember Limon and I are also working on that, and we're hoping to get some positive results so that we can see some movement forward on that. Anything further, anything you wanted to add on that, Assemblymember Limon?
No, I think we've covered it, and I think it's an issue that is a good example of how the federal, state, county, and local representatives are trying to work together to address in the best possible way for the health of our community.
So we have. Sure, please.
I just wanted to on the disease containment and mitigation. Our team, even though this is a federal prison and we have no direct control over the mitigation process, we are in contact with the prison and to make sure that we maintain that open line of communication for guidance if needed or for support if needed.
Great. And of course, it's important to recognize that we do not have, the state of California and certainly the county, does not have any control over what goes on at that federal prison. And Congressman Carbajal is trying to help make sure that we can have some collaboration and cooperation. Certainly, everyone is making their best efforts to try to contain the situation and follow the guidelines, and we are very appreciative of everything that you are trying to do. At this point, we're past our hour, so Assemblymember Limon, any quick remarks before we conclude? We'll then pass it on to Congressman Carbajal for a quick thank you as well.
Thank you, Senator Jackson. Thank you, everybody, for joining us this evening. We hope this has been helpful. We know we did not get through all of the questions. However, all of our offices are available to follow up the discussions. I really want to thank our representatives from both Ventura and Santa Barbara County who continue to be on this every day And I mean, 7 days a week, folks are working long hours to try to get the right answers and do what's right, what's best for our community. So thank you so much, everyone, for participating, and I look forward to being a resource to anyone who has additional questions. Thank you.
Great, thank you. Congressman Carbajal, the last couple words.
Thank you. I hope the answers provided this evening were helpful in illuminating the path ahead of us as we all navigate the process of reopening, and of course, while protecting our health. There are certainly a number of moving pieces, and we must all continue to be patient. Tomorrow, I will be returning to Washington, D.C. to cast my vote for the HEROES Act on Friday, a $3.3 trillion relief package which includes funding for a science-based path to reopening the economy with testing, tracing, and treatment, honoring our heroes with robust funding for state, local, and tribal government, and continued support for our frontline workers, unemployment, small businesses, and nonprofit organizations. The HEROES Act also puts money in the pockets of workers and families. Please continue to heed the advice of our public health officials, and if you have any questions or concerns about your stimulus check, SBA loans, or any other federal matters, please contact my office at 805-730-1710 or send me an email through my website at carbajal.house.gov. Stay safe, stay healthy, and good night to everyone.
Thank you. And thank you to Assemblymember Monique Limon and Congressmember Salud Carbajal for their efforts in this as well. I want to give a special shout out to our CEOs of both our counties, our public health people, Bruce Stensley, and to people listening. You know, we are living in a very challenging time. We are trying to work together. We know we're not out of the woods yet. We've had, in fact, 71,000 plus confirmed cases of COVID-19 in California, almost 3,000 deaths. The virus is still out there. We need to continue to work together to slow down the spread, to try to get back to normal. But remember that safety and good health are the primary, the most important things that we can be doing for ourselves, for our loved ones, for our neighbors, for our community. So as trying as these times are, information constantly changing, realize that we're all working and learning together. We are listening to your concerns, and your government is trying very hard to be helpful during what is an epidemic, a pandemic. Over 4 million people around the world over the last few months have been victimized by this virus. So let's all try to help each other while following social distancing measures. Let's try to open up our businesses to the extent we can and still stay safe. Again, visit my website at sd19.senate.ca.gov. Click on the coronavirus link for more resources. Thank you all. Number 7, let's hope that as we keep discussing and talking amongst ourselves, we can find a way through this situation, working together. We are all in this together. One fight, one team. Good night. Thank you.